What are the risks and restrictions associated with scoliosis spinal surgery? When patients are diagnosed with scoliosis, one thing that always comes into their mind is, do I need scoliosis surgery? And scoliosis is basically an unnatural sideways spinal curvature with the rotation. And the rotation is typically into the concavity of the curve, and the Cobb angle needs to have a minimum measurement of 10 degrees or greater. With this measurement system of 10 degrees or greater, scoliosis is diagnosed into many different severities of scoliosis. Mild is between 10 and 25 degrees. Moderate scoliosis is considered between 25 and 40 degrees. 40 degrees plus is considered severe. And then I like to use a fourth category, 80 degrees or greater, what I call very severe. This is a progressive spinal condition. Normally, it will get worse as is left untreated or if it's not treated proactively. We know it worsens during many key phases of life, but the initial one is adolescent phases. It can progress rapidly during growth. It can also progress rapidly during late-stage life. If it's left untreated, it can progress as the patient's age and left untreated. But it also can progress slowly in juvenile and in younger years before massive growth spurts. And it can also progress slowly during middle life between 20 and like 50 or 60 years of age. So scoliosis is a progressive problem. And because of it, the treatment option as curves become severe is something called spinal fusion. And surgery or spinal fusion, its number one goal is to stop the progression of the scoliosis. That's the first goal, is to keep the curve where it is. And the idea is that it fuses the most tilted vertebra from the very top of the spine, wherever that area is, to the most tilted vertebra below the curves. Now, if it's one curve, the fusion may be only so long. If it's more than one curve, which in many cases it is, the fusion can be this long. It can fuse multiple 12, 13, 14 different vertebrae. And unfortunately, the fusion is done with not only using rods and screws to attach and hold the spine together, but it's also using bone grafts. They implant in between the vertebrae to actually fuse the vertebra in place into one solid bone. So even the rods and screws are there initially to hold the spine during the fusion process to occur. It can come with its own set of risks and associations of side effects and things that can occur as a result of this surgery because, like you just heard, it's a very, very invasive surgery. There's a lot going on, and it's a major surgery. It's nowhere near a minor surgery. Well, first thing can happen, it can be nerve damage. The worst thing that can happen is something goes wrong with the spinal fusion, that it affects the nerve tissue. It affects a nerve either exiting the spine or affect the spinal cord itself. What are some effects? The screws can be put in the wrong area. It can affect the spinal nerves, it can affect the spinal cord itself, and can lead to very severe nerve reactions. There could be excess blood loss. In any surgery like this, there could be an excess blood loss, which can lead to transfusions and can lead to other types of issues as a result of losing a tremendous amount of blood. There could be an infection, and these can be very complicated. There's an infection. It could be in the skin level. It can be down in the bone level. That can lead to a whole other host of issues, sometimes even removing the rods and the hardware themselves and dealing with the effective agent. There could be an adverse reaction or an allergic reaction to the hardware itself, meaning the body responds negatively to the hardware, starts to attack it. It can lead to other types of issues, and they have to remove the hardware. And sometimes they can't reinstall it. Sometimes they can. So that can be another type of problem. And it can lead to hardware failure where the rods either don't permanently attach to the spine itself, or they actually pull out of the spine, and that can lead to more complicated surgeries and more complicated spinal concerns. Well, the most common thing is definitely decreased range of motion in the fused area because you see your spine was definitely designed to move. They're joints, and they're designed to move and flex to be strong and protect the spinal cord and also be flexible so you can move. And the more you move, definitely is related to what type of activities you can perform, meaning the more your spine can move and bend, the more things that you can do as a result of it. Well, if they fuse areas of the spine, you are going to have limited activities and restrictions that you can perform because of the fusion. And the longer the fusion, the bigger the fusion, the more things it's going to restrict. It can cause pain at the site of fusion, not only at a skin level, but at an internal joint level. It can lead to pain and dysfunction. It can tend to lead to degeneration or damage to the endpoints of the surgery because now all the force is being blocked into those two areas. Well, imagine having like a chain that all the links are supposed to move, but now fuse the middle of the chain where all the force and movement, how it occurs into pivotal areas, and that can cause premature damage or premature aging of those areas because they're getting excess use. It unfortunately can lead to disappointing cosmetic results, meaning surgery doesn't return everything back to normal. So patients still have a lot of cosmetic or deformity associated with their spine and their body, even though they've had surgery. And sometimes, a lot of times, the rib deformation and all these things still exist, even post-surgery, and patients can be very disappointed. So even though surgery may be effective at stopping curve progression, it doesn't always lead to all the results that patients want, and it's a non-functional approach, meaning you will have a straighter spine more than likely, but there's an expense for that straighter spine, and that expense is all the things that we just mentioned. It doesn't come with its own host of problems. So therefore, is there possibly a different way to treat scoliosis that doesn't lead to all these negative effects? Where there are different treatment approaches and there are different treatment outcomes, potential outcomes. When we look at the main scoliosis treatment approaches out there, the first one is traditional, and traditional is what leads patients to this surgical option, and it kind of moves people in that way. But there is another one that we call conservative treatment options. Now, in a traditional treatment approach, there is a conservative option there, but their option is basically just Boston bracing that's going to try to slow the curve from worsening, hoping that you don't need surgery. And it's reacting to how severe a curve becomes and tries to either just hold it from preventing fusion, but if you ever get to that level, then we just say spinal fusion is your only option. Where conservative approaches outside of the traditional approach is more of a proactive model, and meaning a proactive model that has a goal at not only avoiding spinal surgery, but also reducing the scoliosis in the midst of its progression to not only stop spinal fusion, but also to make the spine more functional. Because if we can improve spinal function and reduce the curve, we're going to have the benefits of both things. We're going to have a reduced curve and function and still maintain spinal function. So how is scoliosis treated non-surgically? Well, conservative treatment options, ones that are outside of just normal Boston bracing, traditional conservative treatment approach, I like to say, is normally combines multiple treatment disciplines. It's a multimodal approach that's customized for each and every patient. And this is really the key, because when we look at scoliosis treatment, we know just doing exercises alone doesn't really affect the size of curve. Just going to a chiropractor and getting chiropractic adjustments doesn't really reduce the curve. Just wearing a Boston brace doesn't really reduce the curve. It's doing scoliosis exercises doesn't necessarily just reduce the curve. Just doing in-office therapy doesn't always just reduce the curve. But if you combine all these things in a manner that everything adds to the next, and one thing will help the other, and the next will help the next, and the next will help the next, and it's all not fragmented, but all coordinated in one clinic where there's one doctor supervising every single aspect of all the things we just mentioned, all those things now can be actually effective in reducing the size of curve. And by reducing the size of the curve, we can affect the spine on a structural level, meaning we take curves and we actually make them smaller. If we make curves smaller, now we're starting to restore function back into the spine, increasing the strength and core strength within the spine, increasing spinal support and the surrounding muscles. And this will allow us to not only reduce the curve, but not remove all the function that spinal fusion does. So not only we're trying to not only stop the curve from worsening, but we're actually reducing the curve in the midst of its progression. And as long as the spine can maintain the natural function and flexibility and can maintain its normal range of motion and also be straighter, we also think they're going to have long-term benefits as a result of this type of treatment. Spinal fusion is typically recommended in a few cases. And normally it's when patients are just choosing to do it. They say, well, I don't want to treat it any other way. I want to elect for traditional treatment options, and therefore I'm going to consider spinal fusion. And normally spinal fusion will only be considered by the orthopedic doctor if a curve reaches a threshold, meaning they have to be 40 degrees or greater and still growing at this stage, meaning that you still have a likelihood of progressing. So if you have a 12 or a 13-year-old patient that's progressing, still progressing, and they're still growing, and they hit the 4-degree mark, they're recommended spinal surgery. However, if you have a 30-year-old that has a 4-degree curve, they always don't recommend spinal surgery at this point because we know the curves are progressing slowly, which I kind of find interesting, that that surgery is recommended for children, but not for adults. And even at this stage, they normally don't like to do it, even though the curve is the exact same size. And the reason why is because the prognosis is so poor for adults that go through surgery. So if it's bad for an adult but good for a kid, I kind of find that a little bit unusual, but that's just the way that it's normally recommended. So typically it has to be 4 degrees or greater and the person's supposed to be growing. Now, when do they consider spinal fusion for an adult? Well, it also has to be 4 degrees or greater, but it also has to have, the person has to be going through severe impairment, severe disability as a result of the problems. They have severe pain, severe dysfunction, something regarding the scoliosis is severely affecting their life. Therefore, they're willing to risk that type of fusion. So it's not just size of curve with an adult, it's also size of curve and some other type of problem. Now, as patients get older, meaning like 60s and 70s, they don't even consider surgery because the person may more likely not going to survive the surgery. So surgery, even though 40 degrees is considered the minimal size, it's not always the same depending on what age group you are. So for patients that are really kind of choosing to forego surgery, when should you do it? Well, you should definitely never do it before 40 degrees, but my recommendation is that you should try something less invasive first, because if we can reduce the curve and maintain function and you possibly don't need surgery, you can forego all those risks and complications as a result of surgery, and you can possibly get the reduction in your scoliosis that you're trying to get and maintain that scoliosis reduction throughout your life if you continue to maintain it and be proactive regarding your scoliosis progression. And also, if it doesn't achieve what you want, you can always consider surgery second. However, once you actually have gone through scoliosis surgery, the idea of choosing another option outside of that after that becomes very, very limited, because now your spine has gone through major structural changes. There's rods and screws and bone fusion going on there. It becomes much more complicated. Even though there's never any guarantee with treatment, we know treating curves earlier to help avoid its progression will lead to a more positive outcome. So that's what we definitely recommend, is treating curves as soon as you find them to prevent the need for future spinal fusion. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.